We're good, right?
Yeah, we
Awesome.
are started.
All right. So, thank you everyone who is joining or watching this at a later date on our recording on our website. But today we're going to be talking about attachment theory and attachment styles, which I'm really excited about. Is something I find really interesting, and I hope you all do too. And so the title of our presentation today is Attached: How Our Early Bonds Shape Our Adult Relationships. So, come on, work with me here. There we go. So just to set a quick agenda, we're going to first introduce ourselves so you know who we are and who's talking to you. I'm going to go through learning objectives, the basics of attachment theory, the 4 main attachment styles that come from attachment theory, how those attachment styles play out in adulthood, and then talk about how, our attachment styles can be flexible and how we can grow from maybe an insecure attachment, in early life, and how that can change throughout our life into adulthood. And then we have some resources for you, and some reflection questions to kind of take away for yourself. So to start, a little introduction. My name is Pearl Polito, and I am a clinical intern here at Allow Health. And so right now I'm currently getting my master's in clinical mental health counseling at Northwestern University. So there's a little picture of me at the Northwestern Arch. However, I am completely online and I'm here in Maryland. And yeah, I just included some pictures of my lovely dogs, Shadow and Louie. You can see in a couple of my pictures, there's some crochet bandanas, hats going on. Shadow's wearing a little crochet hat. That's one of my big hobbies right now, and absolutely love it. And I will hand it over to Dr. Marybeth Heather to introduce herself.
Hello, hello. So my name is Dr. Marybeth Heather. I'm a licensed clinical professional counselor here in Maryland. I'm also a counselor educator and clinical supervisor. So here we have some pictures that'll help you connect with me. It's a picture from an outing I recently had. That's my dog, Murphy, just living it up at the beach life. That is a sunset of in the Adirondacks that I recently took this summer. And we have a picture of my cat, Mel, who likes to meditate with me. So that is her meditating with me one day.
That's her meditating pose.
That's her meditation pose. And then one of the things I like to do is garden or do different things with plants. I have it both inside and outdoor things going on. And this is one of the blooming flowers that I recently got a picture of in my yard. It was right after a storm. So I was like, ooh, look at all the beautiful dewdrops really on there. It's nice. It's nice. So
that could be enjoy that photo for Google, right?
It's mine. It's mine.
All right, awesome. So just some learning objectives for what we're going to talk about today. For those of you listening, for those of you watching, we'll be able to identify the basics of attachment theory and what the attachment styles are. And then also we'll be able to apply those attachment styles and basic theory concepts to our relationships as adults, and relationships that we have going through life that are separate from our early caregiver experiences. And you will also leave with some resources that will provide more information on attachment styles. A lot of the resources we have also have really great free quizzes that you can take that kind of tell you a little bit more about yourself, and which I think is really kind of fun to do and to learn more about yourself there. All right, so we'll start with the basics of attachment therapy, or attachment theory. So attachment theory focuses on relationships and bonds between people throughout a lifespan, beginning in infancy with our primary caregivers. And so that can mean a parent, that could also mean a grandparent, depending on kind of how your caregiving was, how that was done as in your childhood, right? So that doesn't really mean it has to be a mom or a dad, just a primary caregiver that an infant is kind of relating to and connected to. So psychologist John Bowlby was the first attachment theorist. His primary interest was understanding anxiety and distress that children experience when separated from a caregiver. And to see how those children interacted when their parents were away from them, or how they interacted when they were close to them. He viewed attachment as a product of evolution, which was interesting at that time because a lot of other theorists were looking at it as a learned practice that infants learn through, observing. But he thought of it as this is an innate thing that we are born with. We are born with the ability to attach to someone, basically for survival, right? And so the central theory of attachment theory is, according to Bowlby, is that if the primary caregiver is available, responsive, predictable to an infant's needs, that child will be able to appropriately develop a sense of security throughout, their young life, and be able to have more secure relationships throughout. Another really important attachment theorist that I needed to put on here is Mary Ainsworth. She did a groundbreaking study called The Strange Situation, which involved having an infant be in a room with their primary caregiver, and having the mother or primary caregiver leave the room and see how that child acted. And so through this study, she discovered the 4 major styles of attachment through how these infants reacted, whether they were really anxious when the caregiver left, or if they were pretty, fine with it, able to explore on their own, was able to kind of figure out these 4 different ways that infants are attached, and how that kind of translates into adulthood as well. So why does attachment theory matter? I think it's really important to, when talking about this, that attachment theory is just that, it's a theory. However, the ideas that have come from the theorists, such as John Bowlby and Mary Ainsworth, have influenced so much about how we look at human nature, and how we look at connection as well, and intimacy and all that. And so looking at attachment is really important because it gives us another perspective for so many things. One being how we handle intimacy in our life, how we're able to trust others or not trust others, how we regulate our emotions, and how we deal with conflict too. So yeah, those are some of the important reasons that it's very interesting and important to look at those. So let's get into the 4 main attachment styles. So the first one is called anxious, and it's also known as preoccupied attachment. So usually someone with an anxious preoccupied attachment style has a negative self-view, but a positive view of others. So they often look at themselves in a negative light, but will look at others in a more positive light. Often people with this attachment style deem themselves as not worthy of love. So that kind of makes sense with that negative self-view, not being worthy of a connection, not being worthy of having a partner, or having, a trusting caregiver, right? With that, there's also tends to be a high fear of abandonment for people with this attachment style. Sometimes individuals with this style can be described as clingy or jealous, and that really comes from that fear of abandonment, right? And so kind of going back on where does this attachment style come from, in childhood? Often inconsistent parenting, sometimes a caregiver would be supportive, oftentimes they're misattuned to the child's needs, emotional needs mostly. And this inconsistency with that can make it really difficult for a child to understand their parents' behavior and what that means for them, right? And another huge thing that might come up in a person's childhood that leads to this attachment style is the emotional hunger of a caregiver. And what that means is that the caregiver might be seeking emotional closeness to their child for their own benefit and their own needs without recognizing the needs of the child in that moment.
And oftentimes, this will show up in romantic relationships, right? Maybe your partner wants to have a night out with friends and you're feeling uneasy about them going and spending time with their friends without you. You could also have this show up within a friend group, right? Someone else comes into a friend group and now there's an additional person and you don't feel heard or seen by this other person just because someone else is present. It may not have anything to do with actually what's going on in the room or your friend not liking you in some way. So it shows up in so many ways and can really impact long-term friendships and relationships in general, whether that's with your friends, family, coworkers. You'll kind of see it across environments.
Yeah, absolutely. And I feel like when I think about this attachment style, I often think of like someone who just is overthinking or overanalyzing like situations or interactions with people, and I think that comes from a negative self-view, like, oh, I must have did something, or yeah,
they
I've done
didn't
something
respond
wrong.
in 5 minutes, right, Pearl?
Yeah, right? Yeah, exactly. That's where that
They're
can
at
come
work.
out.
They'd have their phone
Exactly.
locked up somewhere or something. I don't know.
Yeah. A lot of overthinking, a lot of nervousness. Yeah. The next one we'll talk about is avoidant, or otherwise known as dismissive attachment style. So, differing from anxious, people with this style tend to have a more positive self view and a negative view of others. So you can kind of tell there might be like a lot of trust issues with this one, of like that negative view of others, right? High sense of independence and self sufficiency. People with this attachment style often do not want to depend on others, and they don't want to have others depending on them. They want to be self sufficient and they want others to be self sufficient as well. They don't want anyone depending on them. Generally avoid intimacy. I think with this attachment style, people like if I think if someone is getting too close to them, or allowing emotions to become too big in a relationship or a friendship, people with this attachment style may have a reaction to pull away, to avoid that intimacy, to avoid those big emotions. Caregivers in childhood for people who have this attachment style are present, but tend to avoid the display of emotion and intimacy. And they're often not attuned, again, with this child's emotional needs. So they're there, but there's definitely, a lack of those big emotions, both positive and negative emotions, too. I think that's important here as well. They may have experienced caregivers who have grown distant as situations become more emotionally dense. So they may have witnessed caregivers, again, with positive and negative emotions as well, pull back when those emotions come up, right? And then when the child expresses a need for closeness, or a want for more emotional contact, they kind of perceive a door being shut in their face because they see that their caregivers pull away, right? So yeah, I think with this, it's a common, not wanting to get too close, because that's kind of what they've been used to in childhood.
Right.
Yeah.
And you might get physical intimacy, right? Sexual intimacy as
Yeah.
well, and be really close in that area. But there's some sort of like line in the sand or like invisible barrier where you're like, I really don't know much about this person. Like you could
That's a
know
really
them
good
for
point.
years, but there's this like stopping point where they don't tell you personal things or really connect with you. Or maybe they even often focus more on what they need, right? Oh, the time of day or the communication style or the things they want to do, and not even realizing the amount of effort the other person, partner, friendship is saying, hey, what about what I want to do? Right. So it can show up in different ways and really cause harm to both people that interact, right? The avoidant person might not even realize like how avoidant they are. It's all that protection of self.
Absolutely. Yeah. And I think your point about like physical intimacy is really good, because that's so true, that physical intimacy and emotional intimacy are so different, and people have different tolerances for each of those, right? So someone might have a higher tolerance to physical intimacy, but that's not going to translate into their emotional intimacy. Yeah. Disorganized, or otherwise known as fearful avoidant. This one is kind of a mix between the two we just talked about. They tend to move between traits of both anxious and avoidant attachment. So for people with this attachment style, their relationships are often a source of both desire and fear, and can often be described as like this push and pull pattern of behavior. Like you don't really know when they're going to kind of be ready to be close to someone, and then boom, they start pulling away. So it can get a little confusing, a little conflicting with this attachment style. They often dissociate from uncomfortable situations. It's often caused by a perceived fear that's really deeply rooted in their childhood, possibly the result of trauma as well. They may have seen their caregiver, experience a traumatic situation, even, possibly onto them or onto another person in the home. And often they experience caregivers that are inconsistent and often a little unpredictable as well. So again, often possibly witness a traumatic situation that involves the caregiver to create that kind of like dissociation to those uncomfortable situations. I think that's super connected, right?
Yeah. And this is like that person that you never know what you're going to get.
Yeah.
You're like, but we were so enmeshed, right? If you want to use that word, and we're like so vibing. I don't know what happened.
Yeah.
What just happened? That can often kind of fall into this category, right? They're
Absolutely.
kind of moving on that spectrum pretty quickly too.
Yeah, absolutely. There's no kind of rhyme or rhythm to it, right? So the three that we just talked about, the anxious, the avoidant, the disorganized, these are known as insecure attachment styles. And so there's the three insecure, and then we'll move into the one known as secure attachment. So people with secure attachments can depend on their partners and in turn let their partners rely on them, right? So having that, matching style of I can depend on you, I trust you, you can trust me. They thrive being in relationships and are also not fearful of being alone, right? So when we talked about that anxious style, it's like there's a fear of being alone. There's a fear of abandonment, right? But they love being connected to that person, right? So with secure, it's, they have their relationship, but they also can, be self-sufficient, be capable on their own. Typically develops in the first 18 months of life, having that secure attachment to those caregivers. They often experience a caregiver that is predictable, respondent to emotional needs. However, that doesn't mean that their caregiver was perfect, right? I think it's important to preface that, like, being predictable and respondent, does not mean that you need to be a perfect parent. For parents or future parents that are watching, I think we don't know the definition of a perfect parent, right? So this is just talking about someone who is just there and respondent and understanding of emotional needs of the child. At times, the caregiver can be close and nurturing, and other times they pull back and allow them to explore the world as a young age. All right, so how attachment styles play out in adulthood. So how do attachment styles show up in romantic relationships? So we'll talk about secure first. There's often healthy communication there, mutual trust, which we talked about, comfortable with intimacy, emotional intimacy there. Anxious or preoccupied, they have fear of rejection, overanalyzing, we talked about, jealousy, that clinginess. These all come about as an adult, from growing from a child with this type of attachment style. Avoidant dismissive could have difficulty with closeness and intimacy, pushing others away, difficulty displaying their own emotions, possibly difficulty like regulating their own emotions as well, and not understanding them. And disorganized, could have turbulent dynamics, mistrust of partner, confusion around their own emotions as well, and the emotions of others. Just a lot of confusion and turbulence with disorganized, I think, for sure.
And you can change, right? And I want to just highlight that as
Oh
well
yeah,
as you're
and
talking
we'll
about
talk about
this.
that.
You're
Yes,
gonna get there.
absolutely.
We're gonna
We're
get
gonna
there.
get
Just
there.
so you know,
Yes,
you don't have to stay in any of these.
this is
So
not set in stone for the rest of your life.
yeah,
Absolutely.
these
And
can
also
all
it's
change.
yeah, and it's been found too that like people have certain different like attachment styles with like specific people and like others with like other people, right? So again, and that's why I think it's important to say like this is a theory too. Like, like this is we're still learning about how this works in human nature, and this is not set in stone of like if you're disorganized for life. That's not what this is. Yeah. Some common patterns in relationships, if there's a partnership with an anxious person and an avoidant pairing, they could tend to trigger each other. If the avoidant person is pulling away, that can really trigger the anxious person to, push forward of like, what is going on? I need to know what your emotions are, right? Because those avoidant styles tend to kind of pull back and are not really able to let them know about their emotions or even understand their own emotions. So that can be really hard for an anxious style person. Um, Securely attached partners can help regulate a person's insecure styles, right? So if you're someone with an insecure style who's in a relationship with a person who has a secure attachment and had that in childhood, that person can really help pull you out of, your patterns with that insecure style that you may have had in childhood and are trying to kind of get out of, which I think is really interesting. And again, super important, patterns can change with awareness and work. These patterns are not going to be with you for the rest of your life. So just prefacing that again. And that moves us in to growth, healing, and attachment flexibility. A little bit on attachment and how that affects mental health. Attachment styles are often closely tied to our mental health issues. Insecure attachments, so that is the anxious, avoidant, and disorganized, can increase anxiety, depression, can lead to different mood disorders, and others there. Our ability to control our emotional regulation can also be linked to our attachment style. So securely attached individuals will often have, better skills that they've, been brought up with that they have in this area, while insecurely attached individuals may have like heightened emotional sensitivity or difficulty managing stress and other emotions as well. Um, and they can also have a huge effect on our self-esteem. I mean, a big thing with attachment theory is focusing on, who has like positive self-image and negative image of others, or who, the opposite. So it's quite obvious that those have an effect on self-esteem, especially with an anxious attached person, right? Since they have that negative self-image and unworthiness. And can our attachment styles change? Absolutely. Humans absolutely have the capability to grow and learn from our attachment patterns, thus changing our attachment styles. And our neuroplasticity in our brains allows us to rewire our emotional responses and grow and develop as well. And it's actually been found through studies that adult relationships can have just as much as an impact as our early bond with caregivers, which I think is amazing. And adult attachment can be mediated by our personal relationships throughout our lives. So this is really what I love about learning about attachment styles and attachment theory. I just think it's such a hopeful thing to think about how we do have the capability to change and experience what a secure attachment feels like, even if that's not something that we had in our childhood. And I just think that's really amazing, and it's really interesting to learn about.
Yeah, as long as you're open to learn and change, you can anytime in your life. I know that saying you can't teach an old dog new tricks. It's a little bit outdated, right?
Yeah.
Yeah, you can't teach an old dog new tricks if they don't want to. So if you want to be curious about it, if you want to grow and change and move past one of the styles that might not be so secure, or different setting, right? I'm thinking, Pearl, about how many times we've seen people be really secure, maybe in the workplace with attachments, like, oh, I know my skills at work and I'm ready at work. But then when it comes to romantic relationships, it's like, what is
Yeah.
happening? Or it could be the
Yeah,
vice
different
versa,
settings.
like romantic
Absolutely.
relationship. I'm secure with this person. I know them super well, but oftentimes has to get new jobs because they can't get through that piece at work. So then there's that crossover, which definitely counseling can help. Like, is it attachment? Is it identity? Like, what's
Yeah,
going
that's
on?
true.
That's
Yeah,
changing everything.
absolutely. Absolutely. And some resources, further learning. The attachment project. Oh, sorry, Shadow. No. The attachment project is this really great website that has lots and lots of information about the different attachment styles, about how they come about, what they mean for your adult life. And there's a free attachment style quiz there and different educational resources to learn more about your specific attachment style. So that's a really great resource. Therapy to Thrive is similar. They have great resources for understanding and healing specifically anxious attachment. There's also a free ebook on there and different trainings to kind of work with that within yourself, or if your partner you think is an anxious attachment style too, like how to work best with that, right? PositivePsychology.com is another great one I found that offers different worksheets and articles on attachment styles. The Loving Avoidant provides resources for understanding avoidant attachment specifically, again, either for yourself or for a partner or a friend. Attached is a really great book. I know, Dr. Marybeth Heather, that was one of your recommendations, if you wanted to say a little bit about that.
Yeah, I think what's great about the book Attached, and I'm an audiobook person, so you can even like listen to the author read it too. I love it. Just like play in the car. You can also get those at the library, so you don't have to purchase, right? Go and listen, go and read for a little bit. What that book does is highlights all these different styles, but then gives you really real life examples of people and talks about longitudinal studies. And it's not a super um like educational or academic read. Like, it's an easy read. You're not going to be like, what am I reading? It
Yeah.
gives a lot of real life examples for you to understand how does it work in relationships, which is super helpful.
Awesome, awesome. Yeah, that's really great. And then I, of course, put us, Allow Health, here as a resource because we are always a resource, for attachment styles or for whatever else you are kind of coming to therapy for. And we are taking new clients and would be happy to explore attachment styles with you if that is something you are interested in learning more about yourself. And just to end, I wanted to leave with some reflection questions for you to kind of take with you. What attachment style do you think resonates with you after the information we've learned, or after doing some more of your research at some of the resources we provided? How do you feel you show up in your relationships today, and how is that related to your attachment style? And what's one small step that you can take to feel more secure in your relationships if you feel you're not quite at that secure attachment style at this moment in your life? What's something small that could get you closer to that? And maybe how can you talk about that with your partners or your family, and kind of getting there and getting more to that secure style, right? So yeah, just something to take with you. And we have our contact information here at Allow Health, our phone number and email. Feel free to reach out if you have any questions or if you want to schedule a consult.
Yeah, we hope to hear from you. You feel free to comment below or follow us on whatever social media channel you're viewing this, and reach out if you want to do a consultation for something. We do offer free 15-minute consultations so that you can see if we're a good fit to explore your mental health and wellness needs. We all have to get a little more health in our life, right? It's such a busy world we're living in these days.
Oh, yeah.
And hopefully we can help you figure out what's best for you.
Awesome. All right. Thank you all for watching.
Yeah. Thank you, everybody.